Hi, this is Dr. Kate, and I am here with Bethany Kontaxes, and she is a nutritionist, has her master's in nutrition, and she is getting into that field and working out of in the virtual space. So she's accessible to a wide range of people, but also in person at my office as well. So I'll let her introduce herself.
Hi, it's so good to be here with you, Kate. So I got into nutrition a couple years ago, actually. I'd always had a passion for it, and I was, as a teenager, always buying health and fitness magazines and into all of that stuff. But then when I was looking into colleges, I kind of felt that the RD was the only pathway for nutrition, and it wasn't. I just kind of always thought that they worked in hospitals and nursing homes and schools, and that's not true. But at the time, that's what I thought, and that wasn't exactly the pathway that I wanted to go. So I actually went into dental hygiene and practiced for 10 years, and then decided that maybe I should revisit this interest of mine. And I found a program that was a little bit more integrative and took a whole body approach and aligned more so with what I valued.
Nice. That's so funny that you mentioned the health and fitness magazines. I used to have every oxygen and all those different ones. And I also have loved nutrition. That was like one of my favorite electives in school. And
Mhm.
actually, she didn't mention this, but we did go to the same grad school. So my chiropractic grad school also has the master's in nutrition. So very randomly, we went to the same school for different things, and they don't have very many majors.
Yeah, it's true.
But yeah, I definitely like that. Now, how long did it take you to complete that program?
It's about a 2-year program.
Mhm.
So, yeah.
Nice. And so how it works for nutritionists, I think you had said in before that you have to work under like a, is it a licensing system or
Yeah. So if you want to be licensed, so different states for nutrition have different regulations. So if you want to be licensed, then you have to complete 1,000-hour supervision program. So you're overseen for those 1,000 hours of working with clients.
Mhm.
And then you take a board exam and then apply for licensure.
Okay, and that's through the state, just like
Mhm.
for, okay, nice. Because I know like the state licenses in the years that I've been in practice, they started licensing massage therapists too, and that's like a huge change and lots of regulations with that and stuff. But
Yeah.
um, so tell us a little bit about how getting involved with patients has been, or clients, or what, I'm not sure what you call them, but
Yeah, it's been very interesting, and it's been, I learn a lot from working with my clients. So I've seen people that have, hormonal dysregulation, PCOS. I've seen people with rheumatoid arthritis, osteoporosis, um, high cholesterol. I've seen a lot of things at this point. So,
nice, nice. And I do a lot with the women's health end of things, and I know that you've been working with some of my clients that struggle with some of those issues. And I think people think nutritionist or dietitian, and they think just getting a meal plan that would be kind of good for whoever. How
mhm.
does that differ when you're trying to regulate hormones and that kind of stuff?
Yeah. So a lot of people do think that they actually just want a meal plan. Like, can you just give me a meal plan? But it's not really teaching them how to put together a meal. And at some point, they're not going to always keep getting meal plans, or they're going to get tired of following something so structured, or they're not going to have time to get the groceries they needed for that meal plan. And so then it's going to kind of feel like they're just going to choose whatever.
Mhm.
So I'd rather help them learn how their body is reacting to the foods they're eating. And, everybody's tolerance for carbohydrates, for example, is a little bit different. Some people need more, some people do better on less. So I try to help them tune into their bodies and see how things are affecting them and help them learn how to put together a balanced meal and, how that feels when their blood sugar is more regulated or whatnot.
Mhm. And that's an interesting with the blood sugar because one of my patients that's working with you has been wearing the I don't what do you call it, a continuous
A
uh
continuous glucose
okay.
monitor.
And she's really enjoyed it and thought it's given her a lot of insight and surprised her, she said, with either how it doesn't spike or it does with certain foods that she would have guessed it went either way.
Yeah, it can be a really useful tool for people. Especially if they want to see the data firsthand, because I can tell somebody like, oh, you felt this way probably because your blood sugar spiked and crashed. But to actually be able to see it in real time is helpful for a lot of people.
Mm-hmm.
And so many times we get like our blood work done and somebody will get, their fasting glucose tested or an A1C, which is an average over the past couple months. But like a fasting glucose just tells us at that one moment in time what their blood sugar was like. We're not seeing what it's doing throughout the day.
Mm-hmm.
And even if their A1C is at a good level, is that, they could have still had high spikes and low crashes and it kind of evened out and the average was okay. So we're not seeing like on a day-to-day basis what it's doing and how that may be playing into some of the symptoms that they're having.
Okay, nice. And how often do you, or what are the effects when somebody has a real problem, like they only eat carbohydrates at a certain point and then they have the spike and crash?
Yeah, so if people are having like energy crashes midday or they really need that caffeine to get going
Mm-hmm.
or their sleep is disrupted, um, things like that, we can kind of think maybe their blood sugar is a little bit off.
Mm-hmm.
And also, I do like a dietary assessment and I can kind of see like, are you getting enough protein to kind of balance out these carbs or, enough fat and fiber and everything that's an importance. So we can kind of go off of that as well.
Mm-hmm. Now, what when I treat people, I feel like a lot of times the stumbling block is like an extreme amount of inflammation and just in general, I know that having a ton of sugar, even for myself, that's like one of my triggers. If I have eaten a lot of sugar, I'm sure I'm gonna get arthritis in my hands from the work I do, and that they'll be sore and they're
Mhm.
not usually in the morning when I wake up. So like I know for me that that's gonna like prevent me if I had an injury from rehabbing as quickly. And I'm sure everybody is more or less tolerant to different things. Do you try to help them pick out the things that might be, let's say they're not celiac, but they do have a gluten sensitivity or sensitivity to eggs, that kind of thing?
Yeah. So a lot of times I'll have people do what I call like a food mood journal. So they'll track their food, but then they also try to track as many symptoms as they can for me. So, if they're feeling, pain in the morning or throughout the day, or if they, are excessively tired and they can track their sleep as well and their bowel movements and all of that to try to, see if any certain food that's showing up a lot may be contributing to some of their symptoms.
Hmm. That's interesting that with like the sleep that you mentioned. We actually just interviewed a girl that is a therapist but does a specialty in um, doing sleep training, and that's very interesting to me because a lot of my patients don't sleep well.
Mhm.
Whether, and it's not always because they have pain, because usually they come to me because they're in pain, and that might cause them to not sleep, but they'll just be like, no, I don't, I'm not a good sleeper, and that's when we heal. So that's like very problematic to get results. So the food aspect is also interesting. I don't know if you think it's more like timing of when you eat, or just how your body.
Yeah. Yeah, it can be different for everybody, but I do think that sleep is like one huge thing for people, and people don't prioritize it enough. And like you
Mhm.
said, our body goes through a lot of processes when we sleep, so it is so important. So I usually say if we can get people sleeping well, having regular bowel movements, and getting their blood sugar regulated throughout the day, that's a pretty good foundation to build on. And then we can dig in a little bit more if things are still not feeling quite right.
Yeah. It's surprising how much all of that ties in with like the women's health pelvic floor. I mean, everyone has a pelvic floor, so men have it too, but with the bowel movements, with pelvic floor issues, whether it be anxiety and stress and your pelvic floor is shortened, then you have constipation and those kind of things. But a lot of times when people come in for that kind of issue, they do have terrible bowel movement issues. And
Mm.
so it's all those pieces kind of have to fit together. And it's something I think that is missing in mainstream medicine, because your OBGYN is probably not going to talk to you so much about your bowel movements, perhaps, but, or, it should all be connected better, probably, for sure.
Yeah, definitely. And people don't always realize that, if it's been like that for their whole life, that they've only went once a week or twice a week, they don't always realize that that's not normal and that that does need to be looked at. So,
Yeah, well, and definitely with, like you said, they don't know that it's not normal because nobody wants to talk about pooping.
mhm,
Or, and even like, not even the frequency, but what does it look like? And they'll be like, oh my gosh, I've asked that question and I have like the Bristol stool chart. And they're like, what? I don't
mhm.
look at it. And I was like, well, you should. It tells you
Yeah,
stuff.
yes, definitely. Yes, I will frequently pull up the Bristol stool chart for people and have them identify which one if they can.
And
um,
for the listeners, the Bristol stool chart is a like um basically it has different pictures of and descriptions of what your stool looks like, and then it gives you a general idea of what might be going on depending on what. And if you've always pooped that way, you would think, oh, isn't everybody like this? You just don't know what is the normal, because nobody wants to talk about it. I don't think a PCP has ever asked me about it.
no, and I had somebody not too long ago that's having like 5 to 6 bowel movements a day that are very runny. And I'm like, have you ever talked this over with your doctor? And she's like, no, I never thought to. I'm like, well, we might need to investigate this.
Yes, definitely. It's I think just the way we're brought up uh, makes us avoid those kind of things. And like, it's important for your nutritionist, because that's gonna, your food is obviously directly affecting your stool, and how you absorb nutrients, and all sorts of things, for sure. So I bet people are surprised when you bust out the stool chart at their.
Yes, they don't know that anything like that exists.
My patients are usually like, you ask way too many questions.
Yeah.
But very interesting. So the another thing that I've heard through the grapevine for people that work with you is that you don't specifically order blood work, where you write the script out for it, but you'll ask people to ask their PCP or their general doctor to order it for them. And everyone that I've talked to said their PCP is more than happy to order the blood work. It's just that whether or not insurance will pay for it is the only stumbling block. The blood work is not super pricey. What kind of blood work do you usually recommend for people?
Yeah, so every doctor's different, and some are very receptive to it and others aren't. But it doesn't hurt. I can usually fax them a list of what I would like to see and try to, sometimes they'll pick some of them off of that list and go from there.
Mhm.
Um, but if somebody hasn't had blood work in a long time, I think it's just good to get like a CBC and a CMP. Um, that can, and that gives us some insight into like iron too, what their iron would be like, and glucose, their liver enzymes, things like that.
Mhm.
Um, and we can kind of, I can kind of look at it and see some can show, we can infer that there may be a nutrient imbalance that's leading to those markers. Um, if we suspect something thyroid going on, most doctors will only run like a TSH and a T4 sometimes. So I try to get them to run like a full thyroid panel. So we would see T3 as well, and free T3, free T4.
Mhm.
um, Reverse T3 if we can, because if there's a lot of stress or inflammation going on, then we can see that instead of going into T3, which would be what our cells would want, it would be getting pushed into reverse T3. Um, and then like thyroid antibodies to make sure there's no autoimmune component there.
Mhm.
And then just like, like I think a lipid panel every so often is helpful. An A1C is helpful. Um, And if they're struggling with energy, things like that, I think about B12 and their iron levels. So like a full iron panel.
Mhm. Yeah. The the thyroid one, I have a lot of patients that get that bare minimum
Mhm.
check, and then they kind of get written off like it's fine, it's in the regular thing, even though you feel like garbage. So sorry for your luck. Basically, is how it works.
Yeah.
So even just the knowledge of asking for more testing if it comes back the first time, as normal, you know.
Mhm.
And I think even if they're like, I don't want to, I don't skeptical about it. If you say you want it, then they'll usually do it just to not have to talk about it anymore.
Yeah.
But yeah, and I for myself, when I had part of my thyroid had to be removed, and I pushed for more testing before I knew that there was something else going on, because and I don't know if they just think I'm the crazy lady, but they weren't too bad about it.
That's good.
But now that I'm waiting for my levels to kind of even out and stuff, and I do feel better. Um, I had thought about getting like the Dutch testing, and for people listening, that's like a different type of testing that you don't necessarily get from your PCP or anything. Do you recommend any of those kind of testing for people that need a little bit more info?
Yeah, I do really like the Dutch test. So that stands for dried urine test for comprehensive hormones. So it's a very comprehensive test, but it lets us see a lot of different things at one time. So it lets us see your cortisol levels throughout the day, which is helpful. Sometimes doctors will run like cortisol in the morning, but you're only seeing that one cortisol level, and our cortisol has like a curve throughout the day. So we don't want to just see one. We want to see what is it doing throughout the day.
Mm-hmm.
So it should rise in the morning, and that gives you your get up and go. And then it slowly decreases. It's lowest at night when we go to sleep when our melatonin is high. Um, so if people are having sleep issues, it might be elevated at night when it should be low. If they're having, problems getting up in the morning, it can be that it's too low.
Mhm.
So we like to see the whole rhythm to it with not just one point in time.
Mhm.
So it lets us see that. Um, it lets us see like our estrogens, the three main estrogens, and how they're metabolized in the body. So, blood work, you can check your estrogen, but you don't see what pathway it's going down. So, that is one helpful thing for the Dutch is that you get to see that because some pathways have more risks associated with them and, some are more protective.
Mhm.
Um, so we get to see that, and then we get to see like testosterone, DHEA, um, progesterone, melatonin, different markers for a couple nutrients as well. So it
Nice.
lets us see a lot at one time.
I have a lot of patients that struggle with um, either postpartum issues or PMDD. A lot of patients that are struggling to get pregnant that have PCOS, endometriosis, those kind of things that are hormone driven.
Mhm.
And I feel like there is not a ton of testing done for hormones. There doesn't seem to be a specialty out there that focuses in on hormones. Once you do the Dutch test and you find that there are some issues, how do you focus in on using diet to address some of those issues?
Yeah, sometimes we go a supplement route. So sometimes there's supplements that can be helpful, especially, if your estrogen is if you're estrogen dominant. So estrogen dominance, you can have excessive estrogen or it can be relative to your progesterone. So your estrogen level could be okay, but your progesterone could be very low. So it's making it seem like you're estrogen dominant.
Mm.
Um, but, you know, a lo- so cruciferous vegetables are great for things like that, if that's an issue. Fiber, we kind of dig into what actually showed up on the test
Mhm.
and what we can do in that realm.
So you deal not just with the nutritional aspect, but also advising in some supplementation too.
Yeah. Yeah. It can be very helpful for some people.
Mhm. Yeah, that sounds pretty good. I've worked in an office when I was first out of college that um, did a lot of supplements, and I think supplementation, when you like really narrow it down to like what really might affect it, is good. But sometimes people get crazy with the supplements, and we would sell, not me because I'm not a very good salesman, but the other people in the office would sell copious amounts of supplements, and they'd be walking in and I'm thinking, oh my gosh, it's like taking a squirt gun to a forest fire. If you're not going to change your diet, then those supplements aren't going to be very effective.
Yeah. Yeah. Yes. So I do think it's important to make sure that they're not just taking a supplement to deal with everything. Like they need to do diet and lifestyle changes in
Mhm.
conjunction with that.
Yeah, nice.
But yeah, people will come in with huge lists of supplements that they're taking. And I'm like, well, why are you taking this? It's like, let's go through each one and
Mhm.
see.
Yeah, and especially with herbal stuff, I know much less about herbal stuff than like just vitamins and minerals, and they can be very strong and medicinal. I mean, that's no joke, and I think sometimes people need a guidance, like someone like you or somebody else that focuses on that, so that they're not having a negative interaction with maybe one of their prescription meds or another vitamin that they're needing.
Yeah. Yeah, that is I go through everybody's medications and see, what may be depleted by their medication and what can interact with it, even nutrient wise and herb wise,
Mm.
so that we make sure that we're never
Mhm.
getting into anything like that. It would
Yeah.
be.
That's interesting about that. I didn't even think about the medications with that might be the cause of one of your nutrient depletions.
Yeah. So like metformin is big for B12, depleting B12, like statins are big for depleting CoQ10. So,
Mm-hmm.
um, not always. So, that's where testing is helpful to see like, is it having this effect in your body? But it is something to like think about too.
Yeah. So the general gist is that it's what you do with patients is much more involved than you need to eat lean protein, vegetables, and a healthy carbohydrate at each meal to
Yes.
reflect that.
Yes, we do try to get into, the nitty-gritty with their body and what is going on.
Mm-hmm. Nice. Awesome. And what do you hope to? I know lots of nutritionists tend to eventually niche down to something that they want to focus on. What is your hope as you go on here to focus in on?
So I really like working with women who are struggling with hormone issues. Many of the ones that I talk to, they aren't getting the support that they need around that.
Mm-hmm.
Um, So I think that's important. Or if they're having issues with their cycle, their doctor gives them the pill and they think that everything is regulated then because, they're bleeding every month, but they don't realize that, or some don't realize that it's not an actual period, it's like more, we call it a withdrawal bleed.
Mm-hmm.
So then if they go off the pill to try to become pregnant, like everything's back to where it was before they went on the pill.
Mm-hmm.
And it hasn't always been, talked about in that way with them. Um, so I think some education, not that the pill is horrible, but I think it needs to be, there's some education around that. And I think, for those struggling with infertility, there needs to be some more support for them as well, because most of the time they're told, try for a year and then you go to IUI or IVF. So,
Mm-hmm.
and that can be hard on people, mentally, physically, financially. Um, so I just think like having some more support for
Mm-hmm.
those groups of people would be helpful.
Yeah, definitely. It's definitely an underserved area. And to what you said with the birth control really is all out there a lot. So many of my patients are on it from a very young age, like teen years to 30s, when
Mhm.
possibly when they want to have kids. That is a long time period. And my sister she just made the switch as a physician assistant from hospitalist to OBGYN about a year ago. And she really tries to make people aware of some of the side effects of birth control, like the clotting. I feel like that's totally like, yep, yep, yeah, yeah. I mean, that insert that you read, you really should take into account because that you're putting that into your body for possibly 20 years before you stop. That's a long time.
Yeah. And it's just people think that they're regulated then, but you're not having a period because you're not ovulating. So they went all these years without ovulating, and so I just don't think they don't always understand. Women don't understand their cycle
Mhm.
because we're not always taught all about our cycle in school and whatnot. So sometimes they don't know what is actually all going on or what should be going on. So,
Yeah. I actually did a podcast episode on like female anatomy because even that, like our very own anatomy that is attached to us,
mhm.
people don't know what the parts are named. They don't know what the actual different parts do. It's like a total misconception,
Yeah.
and it affects things like fertility and cycles and all that kind of thing.
Mhm.
But yeah, awesome. Well, I look forward to hearing more from you as you do your journey into getting your 1,000 hours in and working with patients. And I'm gonna put Bethany's website below and her bio if you want to reach out to her. She does have that option to work virtually, which is really convenient. And then also in person if you like that in-person experience too. So thank you so much.
Thank you so much.